Yes, 120/80. That is what we call normal blood pressure. However, you're going to come across people who have high blood pressure. So what is high blood pressure? Well, borderline hypertension is 140/90. So if you have a client or your blood pressure is 140/90, probably a good idea to go and get that checked by your doctor. But as you go up from there, you're getting more into what we call hypertension or high blood pressure. So what do you do? Well, first of all, make sure you get it checked by your medical practitioner. But when it comes to training, here are some basic guidelines which you can abide by. First of all, we want low intensity to start with until your blood pressure is under control. So cardiovascular training is good, but you may not do high intensity interval work. Get your blood pressure down while you're working around, probably around the 60 to 70% of maximal heart rate would be a good starting point. Means, yes, you're getting a cardiovascular effect, but you're not really pushing the blood pressure up during that exercise session. So from a cardiovascular point of view, be aware not to go into the high intensity type interval type training. You can do a little bit of interval training at a lower intensity level. When it comes to strength training or any other exercise, make sure you have a good warm up. So you don't want dramatic increases in blood pressure from low intensity to high intensity. You want to have a good warm up so you got time for your heart and your blood flow and your blood pressure to adapt to that raising progressive increase in intensity. When it comes to strength training, again, lower intensity, higher repetitions, and you're not going to go to complete failure where you're blowing a gasket. So you may be working at an intensity of 7 to 8 out of 10 when it comes to the weight that you're lifting, what we call relative intensity. So that means you're never going to absolute failure where you're really straining, but you still feel a muscular effect and you can still progress, but without pushing the limits, because then that's going to increase that blood pressure in the short term until you get that blood pressure under control. Some other things to be aware of weight training above the head, because that tends to elevate blood pressure. Be careful doing very heavy arm work, because it's very easy to vasoconstrict the arteries and the vessels in the smaller limbs with muscular tension. So stick to more compound based movements rather than isolated high intensity type movements. If it's really high blood pressure, you may just do unilateral strength training movements rather than doing bilateral. That way you're only vasoconstricting the blood vessels in one limb without also constricting in the other limb, whether it be legs or whether that be arms. Obviously, make sure you breathe throughout the set. So don't know what we call the Valsalva maneuver, where you hold your breath like you're doing in number 2, and the Valsalva maneuver is very beneficial to use when you're lifting maximal weights for powerlifters more in advance. But what it does, it causes a dramatic intrathoracic pressure in the thoracic region. It vasoconstricts the arteries that can prematurely increase and acutely increase blood pressure that may be enough to cause some form of coronary challenge. That is contributing to the blood pressure. No weight training belts, because that's going to obviously vasoconstrict the thoracic region as well. And be aware of holding hand weights when you're doing lots of walking in that, because then you get what we call the stressor response. That means the isometric contractions in your forearms and your arms can actually slightly increase blood pressure there. So here's a whole bunch of minor things that you can put into place to minimize any probably consequences of someone who's having high blood pressure. And when they get their blood pressure under control, then you can obviously increase the intensity, you can push closer to failure, you can do bilateral movements, and you can do all the things that you want to do. But until that happens, it's better always to play it safe than sorry, and that would be no cow poo.